thanks. Okay, let me share my screen real quick. Okay, perfect. So like Renee said, my name's Abby, well, Abigail, but I go by Abby. And I am an occupational therapist at Bridgeway Academy. We're a school for individuals with autism and other developmental disorders in Columbus, Ohio. And I just want to thank Kanetta for recommending me today for this. Kanetta used to work here at Bridgeway with us, and we miss her, but I appreciate her including me. So like Renee said, I'm going to talk a little bit today about sensory integration and a sensory diet. So some learning objectives that we have for today is to understand what is sensory integration as a process and how dysregulation of our sensory systems can impact performance, to understand the different sensory systems and how they can present in individuals, and then to understand the purpose of a sensory diet, when this can be appropriate for an individual, to understand interoception as a part of the sensory system, and then to learn about the role and importance of OT and the value to the team. So first, sensory integration. This, by definition, is the process of organizing sensory information for functional use. Our sensory information from our environment as well as our body is integrated in our nervous system, and then we utilize that to interact with our environment functionally. An individual or a child with an intact sensory integration system can successfully respond to events in their environment and can adapt and change as things happen. Each of these adaptive responses that we have creates a positive change in your brain due to neuroplasticity. Our brain's always changing, learning, growing, and these experiences that we are able to respond to appropriately help that change constantly. So a really important thing that I want to note today on sensory integration is this is directly linked to a child's emotional state and their ability to organize their behavior. So on the flip side of that, sensory dysregulation, a lot of times we see in individuals a disorder in their sensory integration system. This causes inefficient processing of information that comes in through all of our senses. It can impact educational, social, emotional development, pretty much all aspects of someone's life. It can cause chronic difficulties across the lifespan, disrupts their daily function hugely. We see this constantly all day, every day. Individuals might lose self-confidence, stop trying new things because they're hard and they don't know why they're hard, and it's because their sensory system is not functioning correctly. It can also cause emotional difficulties like aggressiveness, poor frustration tolerance, behavioral outbursts, poor self-esteem. And then often, most of the time, a diagnosis of a sensory processing disorder is accompanied by a diagnosis of ADHD or autism spectrum disorder. A lot of other comorbidities, co-diagnoses we see, but these are pretty much the most common that we mostly see working with this population. So a little bit more about that. Sensory dysregulation directly impacts an individual's ability to perform in all of their daily tasks. Here in the United States, approximately 5 to 16% of children have difficulties processing and integrating sensations, and this affects their participation in activities of daily living. We call these ADLs, and then instrumental activities of daily living, IADLs, are going to be some of those higher functioning tasks like money management, community management, household activities, things like that. But this also can directly impact sleeping, dressing, eating, engaging in play, and participating in leisure and school activities. So like I said, really all aspects of an individual's life. So a little bit about our 7 senses. So most people think of the 5 senses. There really are 7 senses, which I'm going to touch on all of those. Some of this is probably pretty common knowledge, but I'm going to go into a little bit of more detail how we see and utilize these senses from an OT standpoint. So vision is our ability to see. This is our ability to identify and understand what the eye sees. It's critical for learning and moving safely throughout our environment. Having difficulties with your vision can affect daily tasks like navigating rooms in your house, going to a brand new place, handwriting, typing, daily living tasks, plugging in a vacuum, putting on your makeup, putting toothpaste on, finding something in the shower when you're taking a shower. What we receive through the sense of sight can also be calming or alerting sensory stimuli. The quality of light in the room, for example, if it's bright fluorescent light, versus a relaxing dim table light or natural light. These things all change how our body feels if we can feel relaxed, energized, unfocused, just based on our environment. So next is the olfactory sense. This is our sense of smell. This allows the perception of odor and allows us to react negatively to noxious stimuli. For protection. This is important for us to protect ourselves. It also allows us to smell and enjoy food. Additionally, different scents can elicit different sensory responses. For example, lavender, chamomile, those promote calm and relaxing feelings. And then smells like citrus, peppermint, coffee can be energizing and alerting scents. A lot of individuals that have both autism and sensory processing disorders have a hypersensitivity to smell, things that we may not notice, may not smell at all. They have the ability to smell and may be very aversive to them. We'll talk a little bit more about aversive stimuli here shortly, but that can cause big challenges for somebody that has an olfactory aversion. So next is a gustatory. This is our sense of taste. This at its basic level allows us to enjoy food, and also for protection allows us to react negatively to noxious taste. So you taste something that tastes like a chemical, your body knows to spit that out. That's based on our sense of taste. Our tongue receptors taste something, it sends that information to the brain, organizes it and processes it, and then we respond. When a child has difficulty processing this information, taste could be aversive to them, or they could have sensory seeking behaviors related to food, or avoid foods that have overwhelming flavor or texture. They could also seek these foods that have high flavor profiles, like really sweet things or hot, spicy foods. Separate from food textures, some kids who seek high flavor profiles might eat something like a sour warhead and think it's just sweet, like a lifesaver, but then other kids might eat that same warhead and think it's extremely sour, or might eat something like a grape and have that same sense that we would have eating a warhead. So it just simple foods, everybody has different reactions to those. Next is our auditory sense, our sense of hearing. This provides us the ability to receive sounds, identify the quality and where the sound's coming from. It allows us to turn our heads towards sounds, and it's also really important for developing understanding speech and language. This sense also helps us determine which sounds are important versus which sounds to ignore. We all have unique auditory systems similar to smell and taste. Some individuals might be under responsive. They crave those loud noises to feel well regulated, while another might be over responsive to those same sounds, benefiting from headphones or a more quiet environment. Our auditory sensory input similarly can be alerting or calming depending on the nature of the sound. Some sounds like classical music or nature sounds might be calming. These are beneficial when someone's overstimulated. And then alerting sounds like drumming, loud music, or clapping, those can be used when someone's tired, understimulated, or having a hard time focusing. Next is our tactile sense. This is our sense of touch. This sense receives sensations of pressure, vibration, movement, temperature, and pain all through our skin receptors. There's two parts of this, the protective tactile sense and the discriminative. Protective provides us signals of harmful touch, so poking something sharp or feeling something hot, whereas discriminative provides us information about where on your body was touched, how light or how firm that touch was, the perception of the shape, size, and texture of that item. Something really important to note here is something called tactile defensiveness. So this is a term that we use to describe someone who has a sensitivity to touch. So an individual that has this might avoid messy textures or things on their skin like slime, Play-Doh, paint, food on their hands. They might dislike certain fabrics on their body, certain shoes. And some of these things can be unbearable and they don't know how to express that that's what's wrong. Squeezable things like putty, Play-Doh, squishy toys can provide sensory stimulation, both for the tactile sense and what's called the proprioceptive sense, which we'll talk about in a minute. It helps channel your energy, helps encourage the body to feel calm and ready to learn. So next, this is one of those extra senses that's outside of our typical five senses. Our vestibular sense, or our sense of movement. This sense allows us to respond to changes in our head position and our body movement in space. It coordinates movements of the eyes, head, and body to help us with balance. And it's really important for maintaining muscle tone and coordinating the two sides of our body together, or what we call bilateral integration. So vestibular input plays an integral part in connecting our body to the physical world and the space around us. It uses the receptors in our inner ear, as well as input from the eyes and feedback from the muscles and joints. The sensory or the central nervous system processes all of this information and helps us understand where our body is in space, if we're stationary or moving, how fast we're moving, and what direction we're moving. So this system is the foundation in which all of our other sensory systems are developed. This sensation actually develops first in utero. It's the very first thing our bodies develop, and it allows us to carry on daily life skills, educational and therapeutic activities. So this is something that's critical to look at when looking at an individual, because if this system is not functioning, everything else is out of whack. And that's really important to pay attention to and be aware of. Our other bonus sense is the sense of proprioception. This is our sense of body position. It enables an unconscious awareness of our body position, allows the brain to know where each of our body parts are in space and how they're moving. It allows regulation of direction, how much force to use when we're moving, and helps us regulate emotional and behavioral responses. So doing things that have deep pressure and heavy work, like chewing gum or candy, is an example of proprioceptive sensory input. This allows our body to slow down and helps our brain focus on what's in front of us. So for example, a child who is easily distracted, hyperactive, can't sit still, an OT might recommend that that student chew gum or something chewy during class to help them regulate their body by providing that deep input. So completing heavy work tasks like carrying or pushing items provides proprioceptive input to the whole body, not just the mouth. Okay, so next I'm just going to touch on a couple of these. There's a lot on there, but you'll get this so you can read them. Some red flags in a few different categories, things to look at as practitioners, as family members, things to recommend. So if an individual is over responsive, they might be bothered by touch from others or certain fabrics. They might be really picky eaters, in particular about food. It's not something we think about that's coming from a sensory standpoint. A lot of people just think picky eaters are difficult, but a lot of times it's rooted in a sensory disorder. They might have a short attention span. They might be easily upset by transitions or unexpected changes. So even something as simple as we're supposed to go to the park today and it's raining, so we're not, that can be something that is really hard for an individual with sensory processing disorder to get through. They might react aggressively or impulsively to sensory stimulation. So a light touch on their arm, they might respond by hitting you because their body is over responding to that sense of tactile touch on their skin. They also might be irritable, moody, or fussy because things are just too much. Like all of that input coming into their body is basically freaking out and doesn't know how to handle it. That's because they're over responsive. So on the flip side of that is under responsivity. So these kids might not notice when they're touched, or they might not cry when they're hurt. We might think they have a high pain tolerance, but their body might just not be responding and processing that pain appropriately. They prefer sedentary activities, so things that aren't moving. It takes time for kids to respond to their name. That's a big red flag. If you call a kid's name, it takes longer than it should for them to look and pay attention to you. They don't react to being hot or cold or hungry. They don't notice messes on their skin. They don't indicate needing to go to the bathroom. This is another big red flag. People think, oh, my kid's X years old and not potty trained. They're just being difficult, like they don't know all of these things, but they might not be able to have that sensation in their bladder muscle to know they need to go to the bathroom. They might be passive and withdrawn and keep to themselves. Another big red flag is kids who are sensory seeking. This is something that presents a lot in individuals and a lot of times is mistaken for behavioral problems. These kids are constantly on the move, restless, fidgety, rock when they're seated. They like to crash into things, bump, fall, roughhousing. So those kids who push too hard on the playground, those kids who have over responsive physical reactions to things that people think you're just aggressive, they might not actually know what their body's doing. They prefer spinning, jumping, they're always touching things, getting in people's space. They have poor safety awareness. They take a lot of risks. They might lick or suck or chew on things that are non-food. And they might be intense, demanding, difficult to calm down, frequently angry, because they are just needing more. These are those kids that can run 17 miles and not be tired. These are those kids who, like I said, are pushing kids on the playground when they're playing football and they don't know that they're hurting that kid because they they're not aware of how hard they are and how strong they are. Those are just a few red flags. There's a lot more out there. But these are some of the biggest things that we see, especially in kids that also have emotional disturbances or emotional problems. These are things that could be mistaken for behavior that really might just be rooted in sensory. So now a little bit about what is a sensory diet. This is kind of a strange word and something that I think it's important to explain. So basically this process includes introducing select sensory rich activities that are meaningful to that individual and meet their sensory needs. These strategies minimize their exposure to certain sensory stimuli to help maintain optimal arousal. So on both sides of the spectrum, these are things that we are providing to the student to help them, or the individual, to help them regulate and perform, and then also things that we are avoiding or removing from the environment to help increase their ability to function. Ideally, this is carried out at the home and also in a school setting, if they're in a school setting, with consultation of an occupational therapist working on and developing that plan. So why is this used? It has its maximum benefit if it's provided at appropriate intervals, frequency, and duration. This is, like I said, a stepwise process. You have to go through the whole process to figure out what's best. The goal here is to help the child function at their optimal level with ideal attention, self-regulation, emotional contact throughout all of their environments. So what does this look like? You might think, well, diet is a weird word. So what does this look like? It's different for every kid. Or every individual. It contains activities, accommodations, and strategies that you select from a menu to reflect their needs and interests and work through those. We have to remember with this, one size does not fit all. I have never once in my career made a sensory diet and utilized the exact same sensory diet with 2 kids. It might be a similar layout or a similar schedule, but it's going to be different for every kid. It's also going to change over time. That's why it's really important that something like this is monitored by a therapist because it's going to change. Something that was helping a student focus last week might not 2 weeks from now, or something that was upsetting or noxious to an individual they might work through and might be something that's calming to them now. So things change. So I'm going to show you guys a couple different images. I'll explain them as I go, just to give you a little bit better of an idea of what this looks like. So this is an example of more of a general sensory diet. So it says at the top, when I'm tired, I can. So these are things that individual has worked through with their team to determine are things that help them feel more alert and more awake when they're feeling tired and having a hard time focusing. So those things are all there as available as an option. So when that individual is feeling tired, or when a teacher or a parent notices their signals that they're tired, they can present this to them. That individual can make a choice to hopefully help. If it doesn't help, if they're still tired, making another choice. This is kind of an example where it's just kind of used in the moment. This is a little more of a structured example. So on this kind of sensory diet, it has the individual's daily schedule, and then it has instructions. So there would obviously be more with this where they're actually providing how to do the sensory items. But so for example, during sensory time, they're going to be doing brushing and wearing a vest. These are sensory strategies that we use. During the next sensory time after a therapy session, they're going to do slow swinging. They're going to have another therapy session and then more sensory time. So this is kind of a structured, perform one activity that's a demand on you, do a sensory strategy. And again, these are all the sensory strategies are things that have been worked on with the team to determine are a good fit for this student. So these are examples of situational sensory diets. There's a million different, obviously, examples. These are just 3 random ones that I chose. So during outdoor play, selecting a couple items, and they would stick them on there. I'll show you some images. They would stick them on there of, these are things that I can do to help myself perform the best in this. These are things I can do during homework to help me focus and complete my homework, X, Y, and Z. The examples go on. So these are just very basic examples taken from a website that we use a lot here. Just images. You can use images like this, clip art, drawings, real life pictures, words, all of the options are endless. These, like I said, are a very small selection of the billions of images out there. But these can be, so we keep ours here laminated on little individual cards, and then the student can pick and choose and put them on a Velcro board for what's going to work for them in that environment. So a couple tips. This has a lot on here. You can read through it, but I just want to highlight a couple things. It's very important to obtain additional information from parents, teachers, those working with the individual to when you're creating this plan. So you want to look at what times of day are specifically challenging for that individual. How do they respond to transitioning between tasks? What kinds of things do they overreact or avoid? So maybe that's taking a shower. They freak out and panic over taking a shower. So that might be a time to implement something like a sensory diet. How they react to clothing, all the different things like that, because you want to think about some of the things that you're going to trial with them might actually be aversive to them. So if a kid has a difficulty with tight clothes, a weighted vest might not be a good option for them. So there's lots of different things to look at with this. Down here at the bottom, number 4, these, like I said, are just small examples. I showed those 3 on the screen. There's more. Any situation in life you can develop a sensory diet for. One other thing to note is, like I said before, this is a dynamic process. It needs to be changed as the child changes and as they mature. You want to keep close contact with the therapist that's running the diet, and then also the people that are implementing it. So if that's mom, if that's teacher, if that's whoever, caregiver, whatever the situation is, psychologists, like those are the people that you want to constantly be in contact with, assessing the effectiveness and changing this as needed. Okay, so last little topic we're going to talk about is interoception. So this is the perception of senses from inside of our body. So these are physical sensations coming from our organ function, like heartbeat, respiration, satiety, which is how hungry we are, as well as the autonomic nervous system. So those are going to be your fight or flight reactions related to your emotions. So interoception is having the ability to identify those internal sensory feelings, access and understand them, and then respond appropriately to those internal signals. So an example of this is you're doing something and your heart's racing, your stomach's feeling queasy. All of those are reactions that are happening inside of your body when you're feeling anxious or scared, and processing those appropriately as a sensory feeling and realizing that you need to do something about the situation you're in is something we work on with this sense. These sensations usually remain unconscious, but as typically functioning individuals, we have that interoceptive awareness. That's the processing of those sensations as they become available and bringing them to our conscious awareness. So, like I said, identifying that your heart's racing, that you're having a hard trouble breathing, those kinds of things, being aware that those are happening. So there's a huge link between this and emotional disorders. Kids that or individuals that don't have this interoceptive awareness are going to have a hard time processing emotions. So why is this important? This is a window to our emotional experience. Like I said, it can provide us access to working on emotional regulation. They go hand in hand. So knowing what's happening within our body and responding to those things can help us process through emotional experiences. Kids that have, or people that have experienced trauma or have experienced something negative are never going to be able to work through that if their sensory system and their interoception awareness are not functioning. Like, it's just not possible. You're not going to get you're not going to function on an emotional level if you can't even process what's happening inside of your own body. These sensations underlie our emotional feelings, especially, like I said, those are most intense. So feeling scared, feeling anxious, though all those are intense feelings, and our body feels intense when those happen, and becoming aware of that is what we want to work on. These feelings that are happening inside of our body are a precursor for our response. So you might be freaking out, your heart's racing, you're scared, something's about to happen. Someone's response might be to run or to scream. Like that's how that person's reacting to that feeling, but that's not the appropriate emotional response to what's going on. So having interoceptive awareness provides a distinct advantage to engaging in challenging situations. It allows us to process through things that are hard and understand what's happening in our body. Okay, so last thing. I talked a lot about OT and what we do in relation to all of these things. So basically, a lot of people don't understand what occupational therapy is. That's why I think it's really important to talk about it. Why I thank Kanetta for bringing me on here, because it's something that's very important to talk about. So OTs assist individuals in performing tasks, what we call occupations, that are meaningful to them. Basically, we help you do the things that you want to do and that are important to your life. We work across all populations, all settings, you name it, there's probably an OT there. As a school-based OT, which is what I am, we work on a lot of things: fine motor, visual motor, sensory processing, executive functioning. The list goes on and on. We pretty much do it all, as far as things that are functional with our students. So why OT in these situations? OTs specialize in sensory processing. That is one of the biggest things that we do. Across the lifespan. We can develop strategies to help an individual improve sensory integration. We can develop and implement and teach a sensory diet. And then we provide that generalization and follow through and caregiver training. So that's kind of why and where. So there's that. And that's all I have. So I will stop sharing.